Okay, so a very good morning also from my side. So a very warm welcome to this session on the Frontier stage on the topic of innovations in prosthetic and rehabilitation engineering, pioneering the future of bionic dexterity and rehabilitation technology. My name is Olivier Lambercy. I'm a professor in rehabilitation engineering at ETH Zurich, and it's my great pleasure today to moderate this session. So we are going to talk about how robotics and artificial intelligence can be used to rethink healthcare and provide novel solutions that can improve the quality of life of the many people with some form of physical disability. So for this, I have the pleasure to be joined by a great lineup of speakers that are coming both from industry and academia. And to start this session, each of us will have a very short presentation about the work we are doing, and then we will have some time left for an exciting panel discussion. So without further ado, I pass the word to our first speaker, Dima Gazda, who will start the round of short presentation. Please.
Hi, everyone. So we are building robotic limbs for people who do not have hands or legs. We bet that biggest health tech breakthroughs of this decade and next decade will rely on at-scale body data collecting and later on electronics inside human body. We bet that these technology stacks will emerge first of all in community of users of large wearable devices, like prostheses or exoskeletons. We started Asper with this idea 5 years ago, as team of 5, now we're a team of 50. And we built robotic limbs as part of bionic ecosystem that can get way more body data than any traditional wearables. This data is used to build as dexterous prosthetic control as possible. And later it will be used to prolong human's life. Our ecosystem consists of 3 components that are assistive devices that are literally robotics, robotic hands right now, later robotic legs that are being developed, and exoskeletons, and not only of our brand. Second part of the ecosystem is wearable sensors that detect muscle activity and control different assistive devices and gadgets around. They will include this modular array of sensors will include later sensors of general purpose to analyze body fluids and predict many weaknesses of our bodies. And third part of the ecosystem is a software platform with the server part that gets data from wearable sensors and robotics and improve their control over time. We are distributed between US, headquartered in New York, between Germany, we have R&D facility in Berlin, and Ukraine. Our main manufacturing facilities are right now in Kyiv, Ukraine. And we deploy our devices right now in US and in Ukraine. By Wall Street Journal, there are more than 50,000 Ukrainians who lost their hands or legs during the last 2 years. And we're the company that can help most of them. We see that we see like we are very close to a lot of tragic stories. And I feel that most of the stories are a bit similar. They always have a period of tragedy where people feel desperate and feel like the world fell down and there will be no bright future. And then there is a period of hope. And where people start to socialize, like return to their work and see how it will be in the future. And they see that they will be more functional one day than ever before. And from one side, it looks crazy that people are sure that they will rebuild all the functions, will be more functional than ever before, and it will be their body. And from one side, because of stories from Ukraine, we see that hope goes deeper. Like you've seen a bit of the part of the video where one of our users assemble drones with robotic limb, our robotic limb. And the hope to restore the body leads to the hope to win enemies that is 30 times bigger than you. That also sounds crazy. And the biggest question was for us, for our team, where this hope comes from. And we think that it comes from technology. And we think the name of the conference is AI for Good. It's about tech is hope. Thank you.
Thank you very much, Dima. The second speaker would be Professor Robert Riener from ETH Zurich.
Thanks. What are the trends of robotics and AI in rehabilitation? I think I can tell this from my experience as a professor at ETH Zurich and the University Hospital Baalgrist. We collaborate with many other hospitals, and the main target group in our work are stroke patients. Patients who suffer an injury in the brain and then suffer from impairment and many other motor and non-motor symptoms. We can apply our technologies for both, for therapy, for improving the functional status of the patients, but also for assistance in daily life. And an important prerequisite and also trend is that this work is done user-oriented, that the developers talk to the patients and the clinical personnel. Here we can also use AI based on sensor technology to measure and monitor their human behavior and detect their preferences to allow a well-defined user-oriented application of high-tech. Another trend is to go to very high doses. It's not enough to do training 1 hour per week. It's not enough to do training or therapy for 1 hour a day. We need to train the body all day long, like children do it when they learn walking or grasping. A little child in the age of 2 years does about 16,000 steps every day. And this intensity is also required in rehabilitation and rehabilitation technology. For this, we have to motivate the people that they don't get bored and don't do the training. We need motivation. We can apply virtuality, gamification. We were able to use artificial intelligence to detect the arousal level of the people, to get the right psychophysiological engagement in the training. Another way to get it more intensive, to get a higher doses, is to make the technologies variable, like this device called MyoSuit, which we developed in our lab. Here we are able to use artificial intelligence to detect the gait phase, to predict the next phase, and allow the right support level for the patient or for the person with a disability. Nowadays we work on an upper extremity device to help people to elevate the arm against gravity. And the future trend will be to apply therapy not only at home, but hopefully during sleep. We are able to detect sleep stages, body posture using AI. We are able to stimulate the body by changing the posture, by rocking, by doing vestibular stimulation. And we have seen that it can help to improve some of the body status, to reduce motor symptoms or non-motor symptoms, for example, in Parkinson patients. Thanks, Abbott.
Thank you, Robert. We move to our next speaker, who is Amin Metani. He is the co-founder and chief scientific officer at Courage.
Thank you, Olivier. So yes, my name is Amin Metani. For those who wonders, kurage means jellyfish in Japanese, meduse. So now that I have satisfied your curiosity, And before I talk about the device, I would like to introduce a few facts about handicap and physical activity. So, as you can see, most of us are seated here. So it's a very a very good example of lack of exercise. And chronic diseases related to lack of exercise are major killers. The more sedentary our lifestyle, the more we suffer from cancer, stroke, diabetes, heart diseases, just to name a few. And believe me, the list is very long. Less movement, unfortunately, leads to even less movement, and eventually to a significant decrease of our life expectancy and quality of life. And this is even worse for people with a motor handicap. It is estimated that 100 million people worldwide suffer from a motor handicap, an acquired motor handicap. And when motor handicap hits, a countdown begins. It's either move it or lose it. So for stroke survivors, for people with a spinal cord injury, or individuals suffering from neurodegenerative diseases, movement is essential to prevent secondary diseases related to paralysis and the decline, the physical, psychological, and the physical, social, and psychological decline related to their condition. So, in other words, it is vital for people with a motor handicap to sustain a daily adapted physical activity. And this is why we created Neuroskin. So Neuroskin is an AI-powered electrical muscle stimulator. It's a medical device. It will compensate for the parts of the brain, the spinal cord, or the nerves that have been damaged in order to restore movement. So how does it work? A set of sensors are embedded in my pants, my shoes, and my belt. They are transmitting data continuously to an AI that is located in my belt. And this AI, as I move, will analyze my movement and determine the assistance that I need. This assistance is then immediately provided by an electrical stimulator that sends pulses with a precise timing in order to elicit muscle contractions. And these muscle contractions will help me stand up, walk, climb stairs, and even ride my bike. So, sorry, I'm just thinking of what's coming next. In addition, Neuroskin is a standalone gait analysis lab that will allow for tailored medical follow-up. And every time I use the system, the data is collected, it is processed, and it helps us improve our models and eventually provide with a continuously refined assistance to the users. So this technique is called functional electrical stimulation, FES. It has been around for decades, since the 90s. And the benefits of FES have been demonstrated in scientific literature. However, FES never made it, and especially FES-assisted walking, never made it to rehab centers because of its complexity. Thanks to AI, we have been able to make FES walking user-friendly, and currently the system is being used in a dozen centers, and its adoption is growing. By using Neuroskin for 30 minutes a day for 5 days a week, stroke survivors in the acute recovery phase have been able to improve their walking speed and endurance by over 80%, which is about 8 times greater than what is achieved through standard rehab therapy. For people with a motor handicap, even a little improvement in mobility can translate and help overcome the diseases that are related to paralysis. And this has a huge impact on the life of people with a motor handicap, as well as on their families, caregivers, and ultimately on our entire society. So if you're interested in the device, if you would like to try it out, I invite you to come at our booth. It's on the other side, all the way straight ahead, and we'll be happy to set up a demonstration. So thank you.
Thank you, Amin. So our next speaker will be Heike Valery, who's a professor at RWTH Aachen.
Thank you very much, Olivier. So I would like to put into context what you heard today into technological enablers that made it possible to have these breakthroughs. So when I started in this field, robots looked like this. This is a very successful device, a locomotor rehabilitation robot, and it's very suitable for what Robert just mentioned, repetitive training for high dosage. So you can train with this for a long time, and it relieves the therapists of the manual labor of supporting the person. However, it also imposes a certain gait pattern on the person. And what we learned from studies is that it's important to participate actively in the training. And in order to learn, you have to make errors. And you can't really make errors if the device is guiding you in a perfect gait pattern. So what we worked on together with Robert and Alex was to actually make these devices more compliant and interactive, more cooperative. And we made it possible that in this robot you could walk as if the robot wasn't there, if you could do it. And of course, otherwise the robot would assist you. So in this video, the person is actually walking and the robot is just moving with the person. The person's hardly moving, noticing the robot's there. But you can imagine there's still a large limitation to this, which is, well, this is still limited to repetitive movements. This is just walking on a treadmill in a particular pattern. So this is quite a barrier for people who are more advanced and could, oh, somehow I'm losing my microphone here, and could actually explore their motor capabilities to a greater extent. And then the field started embracing a technological breakthrough. It led to a paradigm shift, which was to abandon rigid structures and rigid robots in favor of more compliant realizations, such as this one. You see here a cable robot, the Ryzen cable robot, with the spring in it. So this physical compliance makes it possible to control very finely forces acting on the person. So here we're actually controlling the force vector acting on the little child that's exploring all the capabilities he has, encouraged and motivated by the therapists. And you can see all the robot does is basically prevent falling, and it also helps with body weight support. But obviously, this device is still very much limited, namely to one room. You can only use it in this rehabilitation clinic. You cannot take it home. So that's another barrier that called for technological developments. And what happened in the past years is that sensors and actuators have become a lot cheaper and lighter and smaller. And that made it possible to have the second trend that Robert mentioned, which is wearable robotics. Here's another example of a wearable robot that my lab has been working on, and it's actually a gyroscopic actuator. If you take fast spinning wheels and you rotate them about an axis that's not their spinning axis, what you get is a quite large moment that can act on a person's body, for example, on the upper body to help with balance, prevent falling. In the middle, you see a person, an elderly, healthy person, trying to do a very difficult task, which is to balance along this beam. The person can't really do it without assistance, but with the balance-assisting robot, it's possible to do this. Now, we spent the last 10 years, basically, trying to make this device a lot smaller and lighter. And here's the current version, which is now about 6 kilograms, and still does about the same as this much heavier version from before. But you can imagine there's still a major barrier to this, and that is only people who live in rich countries with very good healthcare systems will ever get their hands on such a device. So not many people who really need balance assistance will get a gyroscopic backpack. So that's, I think, one big limiting factor, cost, making these devices accessible to everybody by making them a lot cheaper. And I think that's where the current enabling technology comes in, namely artificial intelligence. I think by having intelligent behaviors, we can live with much, much simpler embodiments, much simpler hardware. Here's an extreme example that we're actually demoing at this conference here. If you go up the escalators, you see our robot ball Fizzy, which is basically a hybrid between an exercise device with which you can do the exercises that your physiotherapist told you to do, and a pet that actually motivates you to do these exercises and get to the high dosage that you would need to make any steps in your recovery. So this is project in development. We've just basically started it. We're working on many aspects, trying to make it actually intelligent in learning, to maintain the interesting behavior and actually keep people engaged, because people, of course, they're notoriously curious and they always want to see something new. So we need to get this device to be always new and interesting. That's the question of AI. Simultaneously working on hardware to make it super robust, that it can throw it, kick it, bounce it, and really use it like you would a normal ball. And well, we're looking for collaborators. If you're interested in speaking to us, please come and visit us later. Thank you.
Thank you very much, Heike. So we're running a bit out of time, so I'll try to keep my part as short as possible so that we have time for the discussion. But just to give you a brief overview of what we are working on in our group at the Rehabilitation Engineering Laboratory. So we're interested in developing new tools to complement the way neurorehabilitation is currently performed. And we primarily focus on 3 different research directions. On the one hand, trying to better understand the mechanisms behind sensory motor control. How do we generate movements? How do we control these movements? For example, by combining neuroimaging techniques together with robotics. On the second hand, we are trying to develop novel tools to measure what patients are doing or what patients cannot do. For example, using wearable sensors, IMUs, and other types of dedicated robotic systems. And the last area of research is to try to really develop tools that can support neurorehabilitation, really go to the patient in the clinic and try to have an impact on their quality of life. So in a way, why do we need new tools for supporting neurorehabilitation? I think it's important to realize that the way neurorehabilitation is currently provided faces many challenges, right? So currently it's primarily one-to-one, one therapist acting with the patient. And there are more and more patients, so there's a huge socioeconomic pressure on the healthcare system. Rehabilitation is expensive, there are more patients, and we have also seen via extraordinary situations such as the pandemic that access to the hospital cannot always be guaranteed. We also have this so-called fragmented continuum of care. So when patients are in the hospital, they receive very high intensity therapy, but when they're coming back home, there is very little solution to actually maintain that amount of therapy and have them continue to improve. And our understanding behind the mechanisms of recovery, why a patient recovers, why someone does not recover, is still also limited. And I think there one of the big challenges is the lack of quality data to really monitor and track the recovery of patients. And finally, there is also a challenge called digitalization. So there's a lot of changes in the medical field, in the medical professions. And we, of course, as technology developers, we rather like to see this as an opportunity to also try to tackle these different challenges. So here are some examples of the technology we've been developing in our group. Primarily, we've been focusing on rehabilitation of hand function, so grasping, forearm pronation, supination, and also assisting grasping function, because this is really why you're using your arm to manipulate object, interact with object, with your environment. And we developed this different technology. On the left side, you have one device that we use primarily to support therapy in the clinic, sensory motor therapy, so motor function, sensory function, cognitive function. And what we could see in our work is that through the use of these devices, if you make this device accessible in the hospital, we could increase the amount of therapy patients receive by up to 40%. We can also, with the sensors that are embedded in these technologies, generate a lot of data, which we can use with artificial intelligence, for example, to more personalize the interventions to the specific need of patients. And overall, this type of technology can improve the access to quality therapy in the hospital or eventually in the home. You have an example here of a rather simplified version of this device, which we've been using in the home of patients after neurological injuries to give them access to possibilities to continue their training after discharge from the hospital. But when you're at home, one big challenge is how you motivate patients to engage in therapy, right? Because there's no therapist around you to help you. And there we also think AI can be a tool that can support motivation to engage in rehabilitation. And we've been working on developing an app-based virtual coach called Rehab Coach. So it's all based on a smartphone that has several key interactive features, such as, for example, a chatbot based on large language model that can help you navigate with how to use the technology. We can provide also feedback on, for example, the progress on the different exercises. We can also help them organize their day by providing a reminder to engage in therapy, and so on. And if you want to try it, so please come and visit us at the booth 3, just by the entrance, and you can try these two technologies that I just presented. Thank you very much. Good. Right, so we still have a few minutes for a few questions, right? So let me start with the role of AI in neurorehabilitation. So we all said that we use it to some extent. It has entered our daily business, but maybe I would like to have your opinion on what it has really revolutionized in how we perform neurorehabilitation or how we view rehabilitation. So I don't know, what's to start, maybe Robert?
Yeah. So what we do already since quite some decades is to use AI, machine learning, neural networks, to better record and classify movement and movement patterns, for example, in order to also predict certain kind of movement phases so that the robot can optimally engage with the patient or person with a disability. When you ask what's the revolution, I would say it's not there so far, but the potential is there to use a lot of data to better predict also development of symptoms, for example, before the doctor or the patient even realizes that there's a problem. I think that's one of the greatest potentials we have.
Yeah, so dealing with the data that we generate. Eike?
Maybe I can add to that. I agree. We are not fully there yet because there's an enormous untapped potential to also use AI in these embodiments that we have, not just to do it in software to mine data, but also to actually improve all the robotic devices that we have. And I think the main barrier there is to make sure that it's completely safe and MDR-proof, medical device regulations proof, to have such a learning algorithm inside of your system. So that is, I think, something that we have to overcome, safety limitations compared to model-based, very controlled types of software.
Right, so we've heard from the academics who said we're not there yet. Now we have the people from the industry. So are we there yet in the industry?
Well, I used to be an academic too. Maybe I'm being over-enthusiastic, but for us it has been a total game changer. It's a revolution because doing walking with FES was, I mean, some people did it, but it was so complex that you could not even dream of taking it to the hospital. And in a couple of years, like when I started working on FES, it was around 2015, we were doing cycling, rowing, but walking was out of the question. And suddenly it was possible. And we do not come from AI, we come from neurorehabilitation. So I'm not used to this kind of congress, you know, with AI tech people, but more to medical congress. And AI was just the perfect tool to make something that was previously impossible possible. So really to make the technology available to people who need it.
Thanks to machine learning and AI, sensors become way more beneficial. Like we can make way better devices using data now. And second, AI made it possible to individualize devices and robotics and other. As we used AI, like literally by EMG sensors, we detect muscle activity better than without AI, way better, like 3 times better at least. And second, we can predict behavior of users I mean, like if you take up from a table with our robotic enhancement 5 times today, tomorrow's system will see that in this position and acceleration I took up from a table. Probably when this position and acceleration will repeat, I will try to take up from a table. So let's help me to choose cup grip in advance. So that is individualization and more precise detection of muscle activity.
Yeah, that's Robert.
Just to add, I fully agree. The big problem so far is in neurorehabilitation or in rehabilitation in general, when we apply therapy, we do not know who are the responders. Some people respond positively, others do not show any response, and others have even negative responses. So the better recordings and individual interpretation helps to find the responders and then to have a much more efficient, personalized, precise therapy.
Agree, totally agree.
Fully agree with you, but I want to continue a little bit on that. So now when we're talking about models, predictive models and so on, when you go to clinicians, right, so we have a very interdisciplinary field, right? So when you talk to clinicians and you say, well, I have an AI-based model that'll help you take decisions, what's the perception of them, right? Is there any resistance to that, or are they accepted?
Yes, there is a reservation if you come with a solution to them. That's wrong. What you have to do is you have to develop the solution together with them, and then they cannot await to use it.
Right.
We do not pitch machine learning and AI. It's some like tech stuff. What we do, like we decrease false activations, and that's it. I mean, like if you have more precise detection of muscle activity, does it matter like with which tag it is? If you like can prove that it is more precise and it works, perfect. Yes, data like should be like anonymous and etc. But that's another story.
Okay. Maybe I open also to the audience if anybody would have a question. I don't see any hands so far, so I continue with another one. So one aspect that came pretty much in all of your talks as well is to bring the rehabilitation technologies outside of the clinic, so to the home of the patient, directly to the patient. That is difficult, I know it. So what do you see as the main barriers for technologies to make it the home of patients? Heike?
Well, I think most of all, they have to be super easy to use. There should not be a barrier in setting it up and in actually getting the individual to learn how to use it. So it needs to be extremely usable, which comes back to having to design it together with users to make sure that it actually works almost right out of the box, or that there's a proper support structure with it that helps people use it. Yes?
Yes, okay.
Yeah, I agree 100%. When the device is at the hospital, it's some kind of controlled environment. But every time we bring the device to patients' homes, it's a masterclass in how to properly design a system, because you have no idea how they will use and misuse the system, and you need to adapt. And it is a solution to collaboratively design the systems from the start.
Yeah, so user-centered design, robustness, what else?
So I agree with the usability, as Heike mentioned, also safety, physical safety, but also data safety.
That's right.
AI is based on a lot of recording, using a lot of sensors. We would like to measure our patients 24 hours, 7 days a week at home. And then they feel watched, and they might disagree with this. So we have to work on first making the technologies safe, data safe, and personal and anonymous, and that it cannot get to the wrong hands. But we also have to work to build on the trust on the people. I see a trend that people don't trust science so much anymore, and the facts, and they say, oh, I don't want to be watched, and they just say no. We have to talk to the people that they are trusting our technologies.
And I think we need to constrain ourselves in what we can do. So, for example, not include a camera if it's not really necessary, not include a microphone if it's not really necessary.
Totally agree. So, yeah, simple and engaging start, and second, it should really make difference. That's it.
Okay. There's one question, yeah? Let me just bring you a microphone.
Thanks for the talk. Really interesting topic. But my question is, how do you create benchmarks and success criteria for rehabilitation? So you mentioned, for example, robotic prosthetics. So there's one company I spoke to recently is really interesting because they're making robotic limbs, but the idea was, why do I have to create it as like the same robustness as a human arm? Why can't I make it stronger? Or why can't I have like charging ports in my bionic arm? Because then that leads to transhumanism and augmented people, right? So when you're doing your sort of experiments and even testing, like how do you define success, and should we be thinking early about setting guardrails and how much we can augment ourselves beyond what people can currently do?
Yeah, so we define success as how our devices are used during a period of time. We have analytics, and if our users use device during a year, it's a successful case for us. I mean, like if there is no descent of activity during this period of time. On top of this, periodically we make upgrades for all our devices and add some features. Literally, we unlock some features that were there from start. Of course, we start from basic design and basic list of features, but step by step, it will be more and more functional devices. And yes, there are like, we shouldn't be limited to some human and form factor and features of our biological hand. But where we will be in 5 years, we are not sure. We work on this path with market and our users. Thank you for the question.
Heike and then Robert.
Oh, okay, thank you. I would like to add to the question of benchmarking. I think that's a very key question because at first, the idea was what we have to do with all these devices is restore what would be physiological motion, and then potentially another thing that everybody is trying to use as a benchmark is metabolic cost. How energy efficient is this device? But what is slowly starting to emerge, and what I also personally think is much more important, is to look at which function does this deliver to the person, and especially which function that's relevant for this individual. And that's a very different question in terms of benchmarking than how close is it to natural type of movement.
It's a very good question, how to define success. But we have to ask a question to the users. It's maybe not the first drive to be able to walk. Maybe they have more severe problems with urinary functions, for example, or psychological problems. And the success goes more towards the question, how can you improve life quality and independence?
Can I add a bit here? So yeah, in our case, for example, we started to get feedback from users, like literally by asking questions. And we found out that it's way better and right to just see their actions, not their answers. And we have an opportunity to see their actions.
You know, I was attending Cybathlon in 2016, and most of the teams were staying at the same hotels. And during the rehearsals, I was looking at the robot hand competition, and everyone was having like those very fancy robotic hands that, with a wrist that can turn 360 degrees. But at breakfast, those people were not using those robotic devices. They were using very simple mechanical devices that didn't even look like hands. It was just like a pinch, because I guess for them it was so much more practical at that time.
That's right. Okay, so unfortunately, we will have to close the session here. So thanks again to all the speakers for the very nice discussion, also to the audience for the question. And if you have more questions, so take the advantage to grab our speaker. They're still here for a few days, I believe. So thanks again, and let's close it here.
Thank you, Olivier.
Thank you.